Here is my audience for my persuasive speech. Imagine having to make a decision for your child that could possibly change their life for the better or worse. One of my closest friends' 7-year-old son was diagnosed with ADHD. His doctor's first suggestion was to put him on medication. My friend, his mom, decided she wanted to get a second opinion. For the second opinion, the doctor suggested other options, behavioral therapy being one. She decided to go with the second doctor's recommendation, and her son is currently doing great with no medication as of yet. I've read many different articles about giving medication for mental illnesses, whether it be the first resort or the last. According to the article, Kids, Drug, and Mental Health, children are taking medication for psychiatric disorders more than ever before, and a lot of the time they are not being correctly diagnosed and do not seek other medical options. A second opinion and other options may change the route you choose for your child. All other options should be taken into consideration and evaluated before making the decision of putting a child on a medication for a mental disorder. Today, I will go over what other options are available before choosing medication for your child. I will also explain why some parents decide to give their child medication as a first option. Lastly, I will explain how you can explore all other options before choosing to put your child on medication. There are many other options a parent can choose before putting their child on a medication for mental illnesses. In today's society, many people, adults and children, are being given psychotropic medication without being properly evaluated and diagnosed by a health professional. Being a parent of a child that is struggling with a mental disorder can be difficult and may be challenging to come up with a plan. There are many options and resources a parent can give thought to before bringing a medication into their child's world. Starting medication to treat a mental disorder for a child is a serious and tough decision for anyone to have to make. Additionally, one should seek other options and get a second opinion before starting medicine, as it is possible to be misdiagnosed. Children could be given medication that would essentially make things worse. A study done in 2008 and explained in the article, "Should Kids Take Psychiatric Medication?" inferred that the most common problem is inconsistent diagnosis. Fewer than half of the individuals diagnosed with bipolar disorder actually had the illness, while 5% of those diagnosed with something else actually had bipolar disorder. Getting a second opinion and exploring other options before medicating a child is important for their health. While there are other options, some parents may choose to medicate before exploring them. Although medication should be a last resort for children experiencing mental illnesses, it could benefit them. According to psychiatrist Dr. Andres Martin, drugs can be helpful as part of a treatment plan that should include a variety of therapy and support from others. There is valid evidence that when diagnosed correctly, medication can help. It has helped many to function daily. While medication can have a positive outcome, there are also negative side effects that come with it. It would not be an easy decision to make for yourself, let alone your child. It is okay to admit we all need help sometimes, especially with children. The first step, if you notice a difference in your child's behavior and you believe they have a mental disorder, is to seek medical attention. Visit a medical professional. If your child is diagnosed, get a second opinion. Next, come up with a plan with your doctor to help your child. Keep in mind there are alternatives to giving medication right away. Some options being behavioral therapy, psychotherapy, and getting help from family and friends. Finally, make a decision that is best for your child while staying consistent with the plan the doctor provides. Ultimately, the goal is to improve your child's mental health. If you know anyone who may be experiencing this with their child, remind them that resources and other options are available before making the decision to putting their child on medication. Now, to wrap things up. It can be difficult when dealing with a mental illness in children, and giving medication should be the last resort. There are other options before giving medication to children who suffer mental illnesses, and it is important to be informed about them all. As parents, I believe we should explore all other options before making the big decision of putting a child on medication for their mental health. If you know anyone who has a child that may be going through a possible diagnosis, remind them that help is available and there are other options before deciding on medication. Earlier, I told you to imagine having to make a decision for your child that could change their life for the better or worse. Did you imagine it? What would you do?
I'll